I am going to be speaking today on how to prevent medical legal problems occurring in your day-to-day practice. What are the do's and don'ts which one should observe to keep away from the consequences of medical legal problems? Medical legal liability is now an increasingly challenging reality. You are all aware of that, you all read newspapers and you all come across news items which say so and so doctor was made to pay so many lakhs compensation or criminal prosecution was launched and so on. So you all know that, and it's a challenging reality and we must be prepared for it. Doctors are now under intense public scrutiny and there is a serious trust deficit in the doctor-patient relationship. There is an exponential rise of litigation against doctors in consumer courts and under the consumer laws. Violence against doctors is not uncommon. Now, what are the etiological factors? After all, why is this happen and why is it increasing day by day? In other words, what is the changing scenario of medical practice in this country? So let's review what is the current scenario. Doctors are no longer surrounded by an aura of infallibility. The expectations of public have risen sharply in an era of high-tech medicine. There is a rapid rise in consumerism both globally and nationally. The patient is now equated to a consumer or a client. A doctor is equated to a service provider, what they call HCP or a healthcare provider. You are no longer called doctor, you are called healthcare provider, much like internet service provider or XYZ service provider. Healthcare is now almost a commodity. Healthcare is now called an industry, which was not the case in earlier years. So healthcare is something that can be bought and can be sold. You charge a patient, so you are selling healthcare and the patient is buying healthcare. So that is how things are looked into nowadays. The new buzzwords are quality assurance, accountability, medical audit, accreditation. Now, we never thought these words would apply to doctors, but they very much apply to us. Very much there is an accreditation of nursing homes, accreditation of services, there can be a prescription audit, and of course, you are accountable. We never thought that we are supposed to come under these qualities. Also, the unfavorable outcome of treatment is now often equated to negligence or deficiency of service. So just because the patient didn't get cured, he says doctor was negligent, that's why he didn't get cured. And there is an information explosion. There is this media which is 24/7, TV channels which are dishing out news, and they are looking out for news, and if a patient dies or in a hospital there is a death, they are very happy because for the media bad news is good news, and so they are happy to broadcast it. In the bargain, the doctor is defamed and distressed to a great extent. And then of course there is this Dr. Google. Most of the patients come and already they have Googled, they already know, they probably know more than you. So always keep up to date, make sure that the patient doesn't have more information than you have. And so that is how the patient today is much better informed, and hence is to be dealt with great assurance. So what do we need to do because of all these issues? What should be our reaction, and what should be our changes made in our practice? So we need to practice rational, evidence-based medicine. We need to familiarize ourselves with laws relevant to medical practice. And we should identify potential problem areas and learn how to prevent and how to deal with them. And that is what I mainly propose to do in my presentation. Please remember that the best way to deal with medico-legal problems is to prevent them, rather than try to find out how to now deal with them. It is much better to make sure that they don't occur at all. And as the title of my book says, better safe than sorry. So better to be safe than to be sorry. And if you carry out the practices, guidelines, which I am going to present to you, I'm sure you will not be sorry. So what are the preventive aspects? There are a few key aspects on which I will deal. The first one is documentation and record keeping. Now this is the most deficient area of medical practice in our country. We feel that it's not important to document the findings of the patient, or even to preserve those findings, to have a good, proper, comprehensive history of the patient, and we don't document these findings. Because good records are extremely critical to the delivery of quality medical care. You cannot deliver quality medical care without good, diligent record keeping. And also remember that good records are your best defense against allegations of negligence should some patient decide to make allegations of negligence. Remember, legally, what is not documented never happened. Which means if you didn't document, you didn't write, you did so and so procedure, you saw the patient, or you didn't write it, then as far as the law is concerned, it never happened. So what is not documented never happened as far as the court is concerned. And that is the importance of documentation. Now, what are the good qualities of good patient records? What would you consider records, good patient records as good records? So good patient records should be correct, they should be clear, they should be comprehensive, they should be chronological, date-wise, time-wise, and they should be contemporaneous. What is the meaning of contemporaneous? It means simultaneously, along with what you did. Suppose you did an operation today and you write the operation notes tomorrow, then that is non-contemporaneous. It is not, you should immediately record whatever your findings are. So these are the qualities of good patient records. Now there are certain pitfalls which might appear quite trivial, but they can create big problems. And often, most often, they are the cause of the problems. So what are the common pitfalls in record keeping? Now, time of examination. Most of us write, whenever you examine a patient, you always write the date, is it not? You say so and so date. But how many of you write the time of examination? Many of us think it is not important to write the time. But please remember, it is very vital to write that every time you examine a patient, the date should be followed by time. So you must date and time your notes. Then the reports which the patients have, the pathology reports, the CT scan reports or other investigation reports, most of us think it's not important to keep copies of these reports. So it's something that would help you a great deal in case something should go wrong. So please preserve copies of the reports which the patient you have whatever investigation you have carried out. If a patient is admitted, the discharge card which you give to the patient is a very vital, very important document. Most of us take it very lightly. And the junior most person in the department writes the discharge card. Now, it's extremely important, first of all, to write the discharge card diligently And secondly, to make a copy of this discharge card and to preserve a copy of this discharge card. You'll be surprised how much help it would be useful to you if something were to go wrong. Transfer note. When you transfer a patient, again, a lot of people don't take the precaution of keeping a copy of the transfer note. This transfer note, suppose the patient turns serious in your establishment or hospital and you transfer to another hospital, you write a transfer note. It's terribly important to keep a copy of this transfer note, what exactly you wrote when you transferred the patient. And lastly, whatever documents, records, etc. are handed over to the patients, the reports, you must take a receipt from the patient. The patient must sign a document saying, I have received X number of X-rays, reports, my papers. He must acknowledge. And the reason for that is, occasionally a patient who wants to get even with you would say, you never gave me those reports. I don't have, you never gave me. So how will you prove that you gave him? So you must take a receipt, an acknowledgement that these documents were handed over to you. This is done routinely in most large hospitals, but standalone hospitals, nursing homes, smaller establishments often don't follow this practice. The OPD records. Again, OPD records, in my opinion, must be preserved like the indoor records and for as much period as you would preserve indoor records. Because again, the normal practice is that you hand over the prescription to the patient, you write your notes on the patient, and you have no copy whatsoever. And the patient might even lose your record. And then he does not know the importance. You spend half an hour and wrote down the history, what is the past history, what operation you underwent, and then when next time he comes, he says, oh, gum gaya, I don't have, pickpocket mara. They have a lot of excuses. They said, I changed my house, so I lost my record. They have no value for the record. So you must keep OPD records, which is in your own interest. Then there are some other common pitfalls in record keeping. One is handwriting. The doctor's handwriting, whenever somebody wants to say, if I want to tell somebody you have a bad handwriting, what do I tell him? You have got a doctor's handwriting. So what does it mean? The doctor's handwriting is supposed to be bad. Now, this is something which can bring you into trouble sometime if your handwriting cannot be read. So your handwriting need not be beautiful. I am not saying it should be beautiful. It should be legible. It should be legible. In USA, where they reduce everything to a formula, they said if out of 3 people, 2 people can't read what you have written, then you have a bad handwriting. That is a very easy way of making out. Whether you are 3, you show it to 3 people, 2 say I can't read, that means your handwriting is bad. Extremely important to make sure that your handwriting is legible, because in one case, a surgeon in the court, it is very embarrassing. The judge called him and showed him his own paper and said, doctor, please read, and he could not read his own handwriting. So you can imagine how embarrassing it was. So please be careful, at least legible handwriting, need not be beautiful. Then abbreviations, short forms. Please don't invent your own short forms. You must always use abbreviations which are well established, with everybody knows. Don't invent your own abbreviations. So NBM means nil by mouth. Everybody knows about it. Don't create your own abbreviation just because you are lazy, you don't want to write the full form. And lastly, alterations. Now these are all small things, but when something goes wrong, everything is looked under a magnifying lens. And that is the time when even small things catch the attention and you are put into an embarrassing position. Now when you alter, you want to change something in your case paper, never just deface it completely. Never deface it, because there is a suspicion that you wrote something else, then you have totally defaced it, now you are writing something else. So the way to do it is to just cancel it with one straight line so that somebody can read what you had cancelled. Like in a check, what you would do that and then sign it, that you have changed it. So occasionally this can raise suspicions. So this is the way of doing alterations which do not raise suspicion. They're all very simple things. Maybe they may look silly and trivial, but they can lead to big problems occasionally. Then the next aspect is informed consent or consent. Taking consent of a patient for doing a particular procedure. Now this has become terribly important. So this is the era where just consent is not enough. What you do is you need to take an informed consent. So what is informed consent? It is permission granted by a patient to a doctor in full knowledge of the possible consequences of treatment as well as the possible risks and benefits. So patient now is the era of patient autonomy. It's not in those olden days, because the doctor says you get operated, the patient will get operated. Here you have to explain to him there is patient autonomy, it is his body, he has to decide whether he wants to get operated or no, and whether he wants to go operated in this manner or that manner after understanding all the things. So it's extremely important. Just lack of informed consent can lead you into problems. So informed consent is now mandated by law. In fact, not taking informed consent is negligence per se and is actionable. In some cases, absence of consent may even attract the criminal charge of assault and battery. That means, suppose I were to do a small operation on you, take a knife and cut an abscess. Now, if I have not taken your permission, it means you cut me with a knife because you never took my permission. So, the patient must give his written permission. Yes, doctor, I understand. I am giving you permission to operate, and only then it is something which would be called an informed consent. It is only recently that we in India have started giving importance to the concept of informed consent and not considering it as a mere formality. Now here are a few do's for consent. You must take consent even for minor procedures. Please don't imagine you are doing a small procedure, so there is no need to take permission. Even the smallest procedure you do, it's mandatory and advisable to take a written consent. Consent should be procedure specific or operation specific. It should not be a blanket consent. The consent should not say, I am hereby giving permission to my doctor to do whatever operation he wants or whatever operation she wants, and not like that. You can't do that. It should be procedure specific. It should say that doctor has told me that I have appendicitis and I need appendectomy to be done, and what is appendectomy and what are the risks of appendectomy, and what will happen if I don't get operated, and what can happen if I do get operated, what are the risks, etc. It has to be a procedure specific consent and not a general consent. Consent should preferably be in the patient's language. If a patient understands he doesn't understand English, and then you got 3-page English consent, he can say, I didn't understand anything, doctor asked me to sign the consent. So, preferable to have in the language of the patient, which the patient understands, and make sure that most of the time our consents are pre-printed consents. Make sure that all blanks on the consent form are filled so that later on nobody can say that they were deliberately kept blank. Then it's very important to make sure that the patient himself or herself signs the consent, and not even a husband. Even a husband cannot sign the consent for a wife, or a wife should not sign for the husband. the person who is going to be treated himself or herself must sign, that is first. Then wife can sign, husband can sign, uncle, auntie, neighbor, other people can also sign. But patient must sign. Make sure people have landed into trouble because of that. So here are the ingredients of informed consent, and here are 5 do's. First of all, what is really, this is the essence of informed consent. So you must make sure before you treat the patient that the patient understands the nature of his condition, the alternate treatments or procedures, the nature of the proposed treatment, the risks of proposed or alternate procedures, and the chances of success or failure of the treatment. All this you must explain to the patient. This is what you should do. And what is it that you should not do? These are the 5 don'ts. Don't inform the patient that you are going to do a routine procedure, as no procedure is routine. Don't call any procedure routine. That the procedure is treatment or procedure is simple. Don't never say that. Don't say that no complications will occur, because complications can and do occur. And lastly, don't omit to record denied consent. What is denied consent? You tell the patient, okay, madam, you need a MRI. Please go and get an MRI done. Patient says, no, doctor, why do I asking? I don't think I need it. Or he says, I can't afford. Or why do it now? I will do it after 1 month. Whatever. He or she doesn't want to do what you are saying. Then you cannot force the patient. So you tell the patient, all right, madam, don't do it, but please write down here. Take in writing. Okay, doctor said, I have advised MRI to be done. However, I do not wish to do it now of my own wish. I will do it later, or I don't want to do it at all. He is denied. He is saying, I don't want to do it. Record that also. Because it can happen later, the patient says, you never told me. You never said get this done. Then how you are going to prove it? So always better, if the person denies, let the patient say, all right, don't do it, but please say, I have been told to do, I don't want to do it. And the other important reason for coming into medico-legal problems is wrong patient selection. Select your patient properly. Please treat only those patients if you have compatible resources available with you. Do not treat patients beyond your specialty, training, or expertise. Refer them to the right specialist and don't go beyond what you have been trained for. Occasionally, problems occur while transferring a patient. This is a frequent cause. So when transferring a patient to say to another hospital or another facility for whatever reason, please do it at the right time, in the right manner, and to the right place. It is again important, as I have said earlier, to keep a copy of the transfer note. Certificates. Please issue certificates with due diligence. Don't take giving certificates lightly. Whether they are sickness certificates, illness certificate, don't carelessly say, yes, patient needs leave for 10 days and patient is hale and hearty and is enjoying in some disco or somewhere, and you will also come into trouble. Then how come you said the patient needs rest or needs to be away from work? So don't give certificates carelessly. They can land you into trouble. Also, exercise very special caution when issuing death certificates. Unless you know the cause of death, you have personally treated the patient, or you are fully convinced about the cause of death, please do not give a death certificate. There are doctors who have gone to jail because of giving wrong death certificates, because there have been foul play, there have been some kind of murder and things like that, and which the doctor thought is a natural death, gives a death certificate, and he lands up into serious medical legal problem. So be very, very careful while issuing death certificate, particularly. Then of course this is addressed to male doctors. Male doctors, please never examine a female patient in the absence of a female attendant. Without another female member, refuse to examine the patient, because we've had lot of cases which the female patient, because you didn't take the precaution of having another female present, have made all kinds of allegations of inappropriate behavior and so on, and people have come into trouble. So small thing, but make it a practice that you will never examine, a male doctor should never examine a female patient without presence of, I'm saying, female attendant. I'm not even saying nurse, because there can be a male nurse. So you want a female to be along with you while you are examining. And confidentiality is the next issue, which very often has landed people into trouble. Breach, remember, the communication between you and the patient is a privileged communication. It is a secret communication. You are not supposed to tell anybody else. Breach of patient confidentiality is an ethical, moral and legal wrong. Now you should not even tell the husband as to what his wife is suffering from unless the wife gives you permission to tell the husband. Or you should not tell the husband or the wife what your husband has a problem, because it is supposed to be confidential unless they have no objection. If they come together, it's a different matter. It's like a doctor told a lady came to the doctor for abortion, and she had come with some female friend, and he conducted the abortion. And then after about 1 year or so, he met the husband of the patient, and he asked the husband, "How is your wife?" He said, what happened? "Oh, we did abortion." He said, "How can it be? How could she be pregnant? I was abroad." And then there was a big problem, and then they were divorced, and that lady filed a case against the doctor. "You have no business to tell my husband." So confidentiality, we don't have enough time. I could have given you a lot of examples. Very important to maintain patient confidentiality. And you are all entering practice. You must make sure that many people, most of you, I'm quite sure most of you have taken the professional indemnity insurance. It is terribly important. Please do not practice even for a single day without professional indemnity insurance, because in case you land up in a problem, then you could, and you are made to give pay heavy compensation, awarded heavy compensation by the court, then you are going to land into financial trouble. The legal fees are very high, and so it's just like you insure your car or you take health insurance. It's very important to take what is called professional indemnity insurance, so that you are protected in case of any medical legal issues. And I would also talk about this issue which I feel very strongly, and that is at least 30 to 40% litigation and problems doctors face is because of provocation by colleagues. It's a very important cause of medical legal problems. So make sure that when your patient comes, you don't criticize the earlier doctors who had treated the patient, and you don't try to provoke the patient by saying that this treatment was not right, because that is where the medical legal issues often begin, where the patient is now convinced that something wrong was done to him, there was negligence, and now I must sue the doctor. Because please imagine, you could be in the place of the doctor. Your patient could go to another doctor, and how are you going to like it if he is going to badmouth you and to criticize your treatment, and thereby give a chance for the patient to think of initiating medical legal proceedings against you. So please never criticize your colleagues, because that is what can provoke the patient into creating problems for the original doctor. And the next thing which I would feel you should give importance is the communication skills and the communication failure, which is very often responsible for medico-legal problems. The communication between patient and doctor, failure of that results in a breakdown of the doctor-patient relationship. It's very important that you maintain a good communication with the patient. You are less likely to face medico-legal problems. And you must develop communication skills as to how to communicate skillfully. It doesn't come naturally. You have to learn, practice. A common complaint of patients is that, what is the common complaint? That doctors just do not listen. That's a common complaint, and that is something you should keep in mind. Listening is a key to good communication. When we say communication, we think communication means talking. I'm a good talker, so I'm a good communicator. That's not the case. You have to be a good listener. Listening is a good communication. Good is a key to good communication. And for many people, the real art of medicine is just being listened to. You listen to a patient, he thinks he is half all right. So these are the points which I think you should take care of. To summarize, dramatic changes are taking place in the healthcare scenario. We need to identify these changes and develop coping mechanisms. And remember, the best way to deal with medico-legal problems is to prevent them, and therefore it is better to be safe than to be sorry. Thank you.